Welcome back to Small Caps. My name's Kerry Stevenson. Today, I'm talking with George Karafotias. He's the Chief Executive Officer of Wellnex Life. The ASX code is WNX. And who are they? Well, they're basically a brand and product innovator, and they're operating in that very fast-growing health and wellness market. Got about 8 brands. We're going to talk about some of those today, but we're also going to talk about the revenue growth and what's next for this fast-evolving company. George, great to see you. Thank you for joining me on Small Caps.
Thank you, Kerry, for having me today. Appreciate it.
Well, there's been you guys are moving fast. We're going to talk about some of your brands, but would you mind giving our audience a quick, brief overview? I've kind of said it, but you'd say it so much better. Who are Wellnex?
So Wellnex, we look at ourselves as a brand and product innovator, which we specialise totally in the health and wellness market. And that market's worth $10.7 billion domestically, and it's growing year on year. And what we're finding also is that, COVID-19, what it's taught us is people's health is their number one concern. So a lot more of their disposable income is being spent in this market. So the retailers are hungry for products, and so are consumers.
So is that post-COVID? Do you think COVID has put more of a focus on the health and wellness market?
Oh, absolutely. Health and wellness is in front and center of everyone's thoughts, and the acceleration in the market has really accelerated since COVID, even though it was growing pre-COVID as well. And what's interesting, people are looking for more preventative solutions over your traditional treatments. So people want to take more vitamins, more supplements. They don't want to get sick, because if they get sick, they're trying to avoid it. So we're seeing a growth in all the categories in the market, which is giving us great opportunities.
Yeah, you said before that you're also an innovator. What did you mean by that? What makes Wellnex an innovator?
So, as you know, the health and wellness space is a very crowded market. You got some very big multinational companies, Blackmore, Swiss, and you can go on and reel the names off. So what we try to do is innovate products that are a bit different to give us a strategic advantage. So when we put them on shelf, consumers will purchase them. So, for instance, we released Australia's first liquid paracetamol in a soft gel. We released Australia's first slow-releasing iron supplement in a gummy form. We've released a new brand called Wakey Wakey, which is an energy brand, which is now in a gummy and effervescent form. So we've taken our No-Dose, which is a boring old tablet.
Oh, I know No-Dose. Yes, sorry, if No-Dose are watching.
My No-Dose are terrible. No, I'm joking. They're great. They're great. So when we bring a brand or product to market, we try to be a bit different to give us a bit of an edge. We don't want to compete against the large companies. We haven't got their marketing budget. We want the product to sell itself by giving the consumer and retailer something different.
Okay, and with that something different, does that take a while to go through? How do you evaluate your brands? Like, yeah, I think you've got 8 brands. Or products, should I say? How do you evaluate what you think is going to work versus, that's out the door?
So we look at that's a good question, and it takes a while, and we have a lot of hits and misses, and we do a lot of analysis, and sometimes they see through and sometimes they don't. So we look at established markets and see if there's an opportunity we can break into those markets without competing against the big guys. So, for instance, Wakey Wakey is a perfect example. So we've seen No-Dose, been in the market for 30 years. Yeah. Hasn't changed its packaging, still the same sort of format, a pill, a tablet. And I used to take when I was at university to get through my exams. When we saw something that, that market is growing, that energy market is growing, and No-Dose has got the market cornered. So if we produce something that's a bit more different, eye-catching packaging, so we've got a fluoro green packaging, a different way to take your energy requirements, so we've got an effervescent form and a gummy, will this work? And we thought it would, and the results since we've launched our product has proven to us it does work. And that's what we do with all our innovations. We look at existing markets and see how we can do it differently to give us something different. And what's also the retailers like about that is that if we bring something different, they're able to charge a premium price, which keeps their margins up, because this is the game. The biggest challenge for us and for the retailers is to maintain margins. So if you bring something innovative and new out, consumers are prepared to pay a little bit more for that product, which maintains the company's margins and also the retailers' margins as well.
You talk about retailers. Are you partnering with them, or are you just providing product? And I think that you're in Chemist Warehouse, and you also partner with GlaxoSmithKline. So I want to kind of figure out how does that partnership work? Are you in bed together, or are you in separate houses and you come together occasionally?
you've got analogy. We're in separate houses, so we come together occasionally. But we have supply and relationships with all the major retailers, Chemist Warehouse, and even Coles and Woolworths on the grocery side, and the Pricelines of the world. We've developed those relationships over a very long period of time. But what makes us a little bit different is, for instance, like Chemist Warehouse, we have a joint venture brand with them, which is called Wagner Health, Liquid Jeezys. And again, it goes back to our innovation and why we secured that arrangement. We registered in Australia, Australia's first liquid paracetamol in a soft gel. And because of that innovation, Chemist Warehouse was so enthused about the product, they asked us if we could form a brand together, 50-50 joint venture brand, to put that product in. Thus the birth of Wagner Health Liquid Jeezys. So when you have that sort of relationship with like the likes of Chemist Warehouse and even a joint venture brand, you get a lot of that relationship is very, very positive. It assists us in product development, in innovation, but also ensures us when we get a product, when we develop a product or brand, we make sure we get it ranged. And one of our successes is we've never, ever launched a brand or product that hasn't achieved ranging in one of the major pharmacy or grocery retailers here in Australia.
I'm going to be brutal. This is a market, because I know, like, getting a brand, I've got a friend that's I've got a wonderful brand, and it is in some of the, but I understood what she had to go through to get the brand into both Woolworths and Coles. It's tough. What do you think? Why are you going to succeed when so many others don't? Because there are big, as you mentioned earlier, there's the big brands out there with big marketing budgets behind them. What's going to get Wellnex into that position where they're not going to get taken over or made irrelevant?
Because the way we do business, to put it simply, Kerry, it's the way we look at the market and what we bring to market. So everything that we bring to market is different to what our competitors are doing. So there's a value proposition for both the retailer, and they can see that for the consumer. I go back. So, you know, in the last 12 months, we have produced 3 products that are first to market in Australia: the slow-releasing iron supplement, the liquid paracetamol, and a soft gel, and an energy brand that's both in an effervescent and gummy form. So if you bring to the retailer something that is unique and different, and they can see the value proposition, they will range you. And that's what we do. And the other thing I must say is, and where we're different, is that we've built some valuable infrastructure within Wellnex. So everything we do here is done internally. We have a head of regulatory department, so all of our products are registered. We have an internal sales department. We have an internal marketing department. And the other thing that we do have is we have an internal field force team that's scattered around Australia. So what we do is we go and educate. When our product is ranged, we educate the retailer. We can educate the consumer. We can make sure the product is displayed correctly, the correct marketing assets are deployed, which gives the retailers confidence that if they put our product in, we're going to support it to get sell-through. And at the end of the day, that's the key. You can put a product on the shelf, but unless you get sell-through, you're wasting your time. And that's what we can do.
Yeah.
So pull all that together, and this is why, you know, we're still relevant, and we will be relevant moving into the future.
I want to go into the numbers a little bit, George. How big, I think you mentioned it earlier, but just remind me, how big is the health and wellness market?
Latest data you saw in 2021, about $10.7 billion. But what's really interesting, and Kerry, is that 70% of those sales are in the pharmacy channels, and that's where our strength is, with our relationships with Chemist Warehouse being about 60 or 70% of the pharmacy component of the health and wellness market. So, so with 10.7, and it's growing, and that's the latest data I have. And last thing I saw, it's growing about 15 to 20% year on year in that particular market.
Yeah, and you mentioned before that post-COVID, everyone's trying to get themselves. And I agree. I mean, I'm although I was very keen to hear about your, or was it your the new iron company? I think that's the iron supplement in a gummy, because my iron tablets are still sitting out on the kitchen table where they've been there for the last 3 days or something. But I will be checking that out. George, you're also, from what I understand, going into the cannabis market. We haven't spoken about this. I'm really keen to hear. Yes. That's a bit different, or is that still in health and wellness in your opinion?
Definitely health and wellness, but it is a game-changing event for the health and wellness, like what the TGA have done. So what's happened is the TGA have allowed now for the first time to register a medicinal cannabis product as an S3 product, which what's an S3
product?
I'm going to that. Yeah, exactly. Which basically means for the first time ever, You can go straight to the pharmacist, to a pharmacy, and request a medicinal cannabis product without a prescription from the doctor. It's never been done before, and they've just changed the regulations. And we're excited because if you look at the data internationally, and look, Australia's late to the medicinal cannabis market. It's been available in the overseas markets for a very long period of time. And some of the data that's coming out from the overseas market is, they're looking at growth from $12 billion in 2021 to about $57 billion market US in 2028. And the changes that the TGA have done, we're going to see similar increases in the Australian market. So we're putting a particular focus on this, and we're one of the first companies that are commencing the process to obtain that approval, which we expect to obtain towards the end of calendar year 23. And we're going to be targeting pain relief for our registration for a medicinal cannabis product. And we're really excited about the opportunity. This is going to transform Wellnex, and it's going to provide substantial revenue. And the best thing, it's very high margin as well. Very high margin product.
I could be wrong, but I think I spoke to someone the other day who said she was taking cannabis oil. Do you think that's because that's gone through a prescription and it's just hard at the moment? So there's
you're right, Kerry. So there's a thing called the SAS market at the moment, which has currently been in the market in Australia for a period of time, which basically means you go to the doctor, you get a prescription, and you get that prescription dispensed. What's changed is the TGA of allowing the removal of the doctor's part to obtain a medicinal cannabis product. So you get a headache or you've got some pain, you can go to the pharmacist and say, you know what, I want a medicinal cannabis product, and they can dispense it for you on the spot without having the doctor. And even though it's a new market, there is some data flying around that they believe that the S3 space in Australia will be worth about $3 billion by 2025. And we're targeting to be one of the first companies in that space. And if you are, you've got first mover advantage. You can grab a large pie of that opportunity, which we're targeting, which we're really excited about.
George, you said something about the end of 2023. Why does it take so long?
So with any S3 approval, you need to go through a 12-month process with the TGA to get approval, which involves clinical trials. We're expecting our clinical trials to commence in January 2023. Yes, January 2023. And we're hoping to have our application to the TGA for approval by July, August 2023 for approval. And at this point of time, there is no other company who has actually submitted a TGA application for an S3 medicinal cannabis product. So we're pretty confident we're going to be one of the first few. And you can join the dots because we've got that joint venture brand with Chemist Warehouse.
Yeah.
We know where our distribution points are going to come for this product already. So we're investing a bit of money because we know we're going to get distribution, which is going to give us first mover advantage to take this opportunity.
How important are those relationships to growing the business? And I then want to come into some of the revenues and the increase in revenue, because that's what people are interested in as well. But how important are those relationships to you growing the business as well?
Okay, I'll put it this way. We see a lot of good companies who innovate a lot of brands and products, and we get presented them every day. And in our past, BSA used to be a company that used to represent those brands to get distribution in Australia. Without those relationships, without getting your product on shelf, without having the product range properly on shelf, without getting the support of retailers to assist you to sell through the product, you haven't got a business. It's one thing developing a product, but the relationships you form with the retailers are critical. At the end of the day, they are everything about if you're going to fail or succeed as a business. Because if you don't get their support, you have no chance of increasing your revenue or making money. So the relationship we've built over a very long period of time is critical to the success of this business. And we talk a lot about Chemist Warehouse, and they're very important and very large in the space, but we're not Chemist Warehouse centric either. Our products and our brands are in Priceline, are in all the major pharmacy retailers like Terry White and all the others. But also we're in grocery channels as well, in Coles and Woolworths. So our relationship spread far away to a lot of players in the market. So even though we talk a lot about Chemist Warehouse, we're not just Chemist Warehouse centric.
We've talked a lot about the business here within Australia. Before I get onto the numbers, is it easy to expand globally, or is your focus purely on Australia for the moment?
That's an interesting, Kerry. I had a question from a shareholder last night, exactly the same point on this. So the market is worth $10.7 billion in Australia. Our revenue is roughly aiming this year to be about $30 million. So it's very small revenue compared to the total market. The key to success to international markets is to make sure you've got your domestic market absolutely cornered. There is so much low-hanging fruit here in Australia. We see years of growth that we can grow in the Australian market before we even look at international markets. The international markets is also very costly to enter. So until we have, we're profitable as a business here, which we are on the way of doing that, and we've got this domestic market cornered, our total focus will only be on the domestic market from now. If we see an opportunity that could arise internationally, yes, we'll look at it. But our total focus at the moment is in the Australian market.
I think that's really smart, because you might as well get your home in order here and get a very strong base here rather than spreading yourself too thin. And I've seen other companies do that, where they spread themselves too thin and then it becomes a disaster. All right, let's talk numbers. When did you list again on the ASX?
So we listed Wellnex on the ASX on July 2021. Mid-July. Yeah.
So just over a year old. How much have revenues grown? Talk to us about the numbers and where you see the shareholder value moving forward.
So there's two parts to that question, Kerry, and it's a good question. One is our revenue growth, which is we'll be about 50% revenue growth in financial year 23 compared to financial year 22. So we're looking last year, financial year 22, we did about 18.5 million. This year, we're on track to do $29 million revenue. But what's interesting, I've got to say, is our first quarter is actually above budget, where we've grown about 70% on the first quarter of financial year 23 compared to last year. If we keep tracking that way, I'm pretty confident we can actually beat that revenue figure of $29 million as well. But the second part of that question is not just about our revenue growth, is where we're deriving our revenue from. So we're seeing a greater portion of our revenue from our own brands. And the reason that's important is that's what gives us the most margin. And that's what's going to give the business back to be in a profitable state towards the end of financial year 23. So it's not only the focus on the company about where our revenues, the growth in our revenue, it's where we're deriving our revenue from. And that's what's really exciting for us as a company, is the brands that we have launched and are launching, and the margin that's giving us is going to put us into a profitable position. And that's our aim, to be profitable by the end of this financial year.
George, in saying those revenue numbers, it doesn't take into account when the cannabis division comes in, does it?
No, absolutely not, Kerry. And that's because we won't be selling cannabis until financial year 24. We've done some internal estimations. If you think about the industry worth about $3 billion in 2025, we'll be one of the first ones to get registration. Even at 2% market share of that cannabis is a $60 million revenue.
All right. Well, that's the numbers don't.
I'll just put it out there. And that's what we're targeting. We have an aim as a company, and my internal aim, it's written on my wall. By financial year 25, we want to be a $150 million revenue company.
And that's on your wall, is it?
That's on my wall. That's my goal every day. That's what my aim is. $150 million by 25.
That's almost 10 times your 21 rev.
Yep, that's okay. There's a lot going on, a lot coming up.
All right. Any other news that's coming up before I wrap it up and ask you for 3 reasons people should say? Any other points you want to make?
So even though we've launched a lot of brands in the last 12 months, we've got some exciting launches coming up for the remainder of this year, including a medicinal cannabis product under the SAS scheme. So we are getting into that market in December or January this year. We've got an organic A2 infant formula brand coming out in October, which will be Australia's first, using all Australian milk. Mark Wahlberg's performance-inspired sports supplement brand will be available in October. And one of the other exciting launches is in November, we're launching a new e-commerce platform, online platform, which will have a new online brand only available on this particular platform. And the good thing about that is, Kerry, and I talk a lot about it, but this is really critical. It's all about margins. That platform will give us about 65 to 70% margin on all the products we sell, because you're not giving margin away to the retailers. So there's a lot coming up.
I was just about to ask you, does that e-commerce platform have the potential to upset your retailers that say, well, we want the product in our stores, why are you selling it direct?
No, good question. And this is why we're forming a new brand, available only on our platform, so not available in the retail sector. But we will be promoting our own brands that are in the retail space on this platform. But one thing we'll never, ever do is undercut our retailers.
Okay. All right.
And that's critical. As long as you don't do that, the retailers will be happy. We'll never do that because we want to work with our retailers, not against them.
Yeah, well, and I think that's but look, the numbers are very strong, and I think that you should come back in a few months' time and give us an update on how you're doing with those numbers. But for now, I just also want to make one point. You've just acquired Mr. Bright, haven't you?
Yes, that's correct.
That's a teeth whitening brand. I got a bit excited about that because there's, again, as I said right at the beginning of this conversation, what makes you different? Because there's plenty of teeth whitening brands out there, but Mr. Bright, is that all natural or something?
Yeah, it's chemical free. It uses all natural ingredients to give you that teeth whitening effect. And let me just say Kerry, the reason we bought that particular brand is it's got very minimal distribution channels here in Australia. So it does a lot of online sales and some international sales. So even though the company is profitable and doing about 800,000 a year annualized EBITDA, normalized EBITDA, I should say, we think we can, grow that revenue EBITDA figure really substantially in a short period of time by getting it distributed here in Australia, in Australian pharmacy channels and grocery channels. And there has been some interest already shown to us to take that brand with the likes of Chemist Warehouse and some other players as well. So we're really excited about that.
But won't somebody like Colgate, who have got all those teeth brightening and whitening kits, won't they just try and slam you out? Because they're a big, big brand, aren't they, Mr. Big? And they'll try and wipe you out.
But it goes back to what I said to you before, Kerry. It's about being different. Our packaging is different. The product is a bit different. It's an all-natural product. So we don't want to compete against Colgate. Like we don't want to compete against some of the large iron companies that produce iron products. So it's all about being different. It's all about being innovative and playing in that niche space and getting your followers up and the brand and customer awareness up. And that's what we're doing as a business. And we're excited about the Mr. Bright acquisition.
When's the e-commerce platform going to be ready?
Mid-November.
Oh, so not far away. So what's the URL? How can people find the e-commerce platform in November when they go looking for it?
Sorry, say that again, Karen.
What's the URL? What's the website for your e-commerce?
That's a bit of a secret at the moment, Kerry. We'll give you some more details. All I can say is that the platform has been developed. We're just testing it out, testing our logistic partners out to make sure products get delivered on time to the right address, which is really going to be really important. So we're doing some testing, and we'll be launching that mid-November. So.
All right, watch this space. Might have to get you back in mid-November. All right, George, give me 3 reasons why people should be sitting up and taking notice of Wellnex right now.
1, we got extraordinary revenue growth. This year's revenue will be up 60% on last year. And what we have in the pipeline, that revenue growth will continue into the future years. And that's really exciting. And number 2, you don't have many companies that can form alliances with the likes of Chemist Warehouse and GSK. Now, that just validates who we are as a business. We're an innovative business. So when a company like GSK wants to take a product off you, it must offer a point of difference. And that's exactly what we do. We offer a point of difference, which gives us the best chance of succeeding in the market. And 3, and the game-changing medicinal cannabis market. We will be one of the first companies to get an S3 registration in this space. And we've got the distribution channels, i.e. like Chemist Warehouse, which ensure our product and our brands will get the first mover advantage, take advantage of all the opportunities that the S3 space offers.
Well, there you have it, ladies and gentlemen. George Karafotias, he is the Chief Executive Officer of Wellnex Life. As I said right at the start, the ASX code is WNX. And as you also heard, George has got his revenue projections up there on the wall of 150 million, currently at about 18.5, going up to 29. But he's thinking big, and I love the brands and I love what these guys are doing. So thanks so much for joining me on Small Caps today, George.
Thank you, Kerry. Thanks for having me.